Good evening, wherever you are. This is Benji Cross from ConferenceHype. Our segment will focus on the next generation of antibody-drug conjugates. From the 2026 August 4 edition of Nature Medicine. Background: artificial intelligence is increasingly permeating healthcare, from serving as a physician assistant to powering consumer applications. Methods: the opacity of AI algorithms makes the ability of humans to interact with AI algorithms challenging. Results: with fairness-constrained model training, assistance from an AI model that achieved balanced performance across skin tones, improved final diagnostic accuracy, and reduced skin tone-related performance disparities among both lay people and PCPs. Discussion: these findings highlight XAI's varying impacts based on human expertise and the timing of when the AI-based prediction is provided, underscoring the concept that LLMs can act as a double-edged sword in medical AI and informing future human-AI collaborative system design. From the 2026 August 10 edition of Nature Medicine. Background: although CD20-directed B-cell depletion has long been used in neuromyelitis optica spectrum disorder, high-quality, large-scale, randomized controlled trials remain limited. Methods: although CD20-directed B-cell depletion has long been used in neuromyelitis optica spectrum disorder, high-quality, large-scale, randomized controlled trials remain limited. Results: eligible participants aged 18-70 years with aquaporin 4 immunoglobulin G seropositive NMOSD and an expanded disability status scale score of 7 or lower were randomly assigned to receive intravenous obinutuzumab beta 1000 mg or placebo. Discussion: clinical trials. GOV identifier NCT 053141010. From the 2026 August 6 edition of Nature Medicine. Background: recurrent glioblastoma is a leading brain malignancy with few therapeutic options. Methods: here we present the complete results of a phase 1 trial investigating the safety and efficacy of autologous B7H3 targeting chimeric antigen receptor T-cell therapy for the treatment of RGBM. Results: the 12-month overall survival rate was 66.7% and median OS was 19.1 months from first infusion. Discussion: clinical trials. GOV registration NCT 05241392. From the 2026 August 10 edition of Nature Medicine. Background: chimeric antigen receptor T-cell therapy induces durable remissions in lymphoid malignancies, yet the extent and biology of long-term CAR T-cell persistence in B-cell lymphoma remain unclear. Methods: here we report the persistence and characteristics of 4-1BB co-stimulated anti-CD19 CAR T cells up to 10 years after infusion in 38 patients with non-Hodgkin lymphoma. Results: long-term persisting CAR-19 cells exhibited a predominant double-negative, effector memory-like phenotype associated with increased aerobic metabolism and T-cell activation programs. Discussion: clinical trials. GOV registration NCT 02030834. From the 2026 August 14 edition of Nature Medicine. Background: aging is the primary risk factor for chronic disease and is characterized by profound structural and architectural remodeling of human tissues. Methods: here We present a comprehensive assessment of these changes using 25,712 whole-slide histopathological images from 40 tissue types across 983 individuals in the genotype tissue expression cohort. Results: by leveraging deep learning, we quantified nuanced morphological alterations to develop tissue clocks, predictors of biological age that reflect tissue structural integrity and physiological fitness. Discussion: this work positions tissue architecture as a critical integrator of molecular and cellular changes over the course of aging, demonstrates that histopathological imaging provides a robust framework for monitoring tissue-specific aging, and offers a scalable foundation for understanding organ-level physiological decline in health and disease. From the 2026 August 5 edition of Nature Medicine. Background: nightmares are a hallmark of post-traumatic stress disorder, yet pharmacological treatments remain limited. Methods: here we conducted a multi-center, double-blind, randomized, placebo-controlled trial to evaluate the efficacy and safety of dronabinol for PTSD-related nightmares. Results: at week 10, reduction in CAPS-IV-B2 scores was significantly greater with dronabinol than with placebo, between group difference -1.5. 95% confidence interval -2.28 to -0.71. Cohen's d equals 0.65. P 0.001. Discussion: clinical trials. Gov. NCT 044488808. From the 2026 August 12 edition of Nature Medicine. Background: triple-negative breast cancer is an aggressive subtype comprising 10–20% of all breast cancer cases and has a worse prognosis than other subtypes. Methods: this open-label, multi-center, single-arm, phase 2 clinical trial evaluates the safety and efficacy of ivonescimab combined with chemotherapy as first-line treatment in female patients with locally advanced unresectable or metastatic triple-negative breast cancer who have not received previous systemic therapy. Results: triple-negative breast cancer is an aggressive subtype comprising 10–20% of all breast cancer cases and has a worse prognosis than other subtypes. Discussion: clinical trials. Gov. Identifier NCT 052276664. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 10 edition of Nature Medicine. Background: type 2 diabetes prevention efforts have largely focused on intervening when dysglycemia is already established. Methods: we propose that T2D prevention be reframed around prediabetes remission, with preservation and restoration of normoglycemia as the optimal clinical goal. Results: the transition from normoglycemia through increasing dysglycemia to T2D is progressive and cumulatively shaped by biological, behavioral, and environmental exposures across the life course. Discussion: our framework identifies 10 priorities in T2D prevention, moving beyond traditional approaches toward context-specific, actionable interventions capable of altering the natural history of disease early in the life course and restoring metabolic health. From the 2026 August 6 edition of Nature Medicine. Background: psilocybin-assisted therapy may be a promising new treatment for treatment-resistant depression. Methods: We examined the feasibility of administering a single 25 mg dose of psilocybin or placebo with psychological support in a randomized controlled trial design with 6 weeks of follow-up. Results: the adjusted between-group difference at week 3 on the MADRS was minus 10.41, favoring psilocybin, which was sustained at week 6. Discussion: UDRA CT number 2018-00357397. From the 2026 August 7 edition of Nature Medicine. Background: millions of users turn to consumer artificial intelligence chatbots to discuss emotional, behavioral, and mental health concerns, creating an urgent need for rigorous and scalable safety evaluations. Methods: here we introduce simulated vulnerability amplifying interaction loops, a clinically validated framework for auditing chatbot behavior in mental health contexts. Results: SimVeil simulates users with specific psychiatric vulnerabilities and conversational intents, engages them in multi-turn conversations with frontier artificial intelligence chatbots, and scores each exchange across 13 clinically grounded risk dimensions. Discussion: SimVeil provides a scalable framework for mapping mental health risk across users, chatbots, and conversational trajectories, offering a foundation for targeted safety improvement. From the 2026 August 11 edition of Nature Medicine. Background: Daraxonrasib is an orally bioavailable RAS multiselective tricomplex inhibitor of the oncogenic mutant and wild-type variants of N, H, and KRAS. Methods: we previously reported encouraging efficacy in a phase 1-2 clinical trial evaluating daraxonrasib monotherapy at clinically active dose levels in patients with previously treated RAS mutant metastatic pancreatic adenocarcinoma, providing the basis for confirmatory evaluation in the randomized phase 3 RA Solute 302 clinical trial. Results: here we report mechanisms of acquired resistance to daraxonrasib monotherapy observed through targeted sequencing of over 800 genes in paired pretreatment and end-of-treatment, circulating tumor DNA samples from 44 patients in the phase 1-2 clinical trial. Discussion: collectively, these results show that most daraxonrasib genomic resistance mechanisms drive reactivation of RAS pathway signaling and guide potential combination strategies in PDAC for further investigation. That's it for now for ConferenceHype's coverage of the August 2026 issue of Nature Medicine. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.